And now I'm talking to Niall Mulligan, the Executive Director of HIV Ireland. Niall, how's it going?
I'm grand, Darren. How are you?
I'm fine, thanks. Niall, could you give me a summary of the HIV situation in Ireland today and the history of HIV Ireland? I mean, like, how many people do you know have HIV in Ireland today? And before we talk about the services HIV Ireland provide here, could you tell us about the state services and how far they have evolved since the virus was first diagnosed in Ireland?
Okay, a few questions in there, Darren. Well, maybe if we start with the numbers, because the HIV has only been diagnosed or been recorded since the late 80s. So we know that over 7,000 people have been diagnosed with HIV since the late 80s. That doesn't necessarily mean that the 7,000 people living in Ireland with HIV, because some will have passed away, some might have emigrated. So a rough estimate will be maybe between 3,500 to 4,000 people living in Ireland at the moment who we know have HIV. In terms of state services, I suppose they are by and large very kind of clinically based. And I mean, if you go back to the 1980s when HIV first came on the scene, I mean, it's completely different back then to what it is now. But like, I mean, if you were diagnosed with HIV in the 80s and even in the early 90s, you really had it as it was a death sentence and that you were going to pass away. That's all changed because of medication. So I suppose the state services have changed as well in terms of sort of like the clinical side of it. So it's a lot to do with treatment and getting people into treatment and also getting people tested for HIV. So the state services they're very good. They're very good.
Okay, it's remarkable, as you said there, the HIV is no longer a death sentence. I wanted to research the matter of HIV and AIDS from an Irish as well as an international perspective. So one of the things I did was watch a couple of videos on YouTube of people dying with AIDS. One was from the 80s, one was a more recent one from Africa. But that doesn't really happen anymore in Ireland and across Western countries, doesn't it?
Well, you certainly wouldn't have the same numbers of people dying now that you would have had 20, 25 years ago. But still, like in 2014, there were 377 newly diagnosed people with HIV. One of those individuals died. And another 8 we knew had been diagnosed also died. So there are still people dying from HIV-related illness. But yeah, the numbers are nothing compared to what they were. But it's still, it's, you know, obviously for those individuals and their families, it's huge, a massive thing in their lives. But you know, I suppose the attitude towards HIV now has changed so significantly in terms of treatment that that's no longer the issue. People are living an awful lot longer, much healthier lives as long as they get onto treatment. And
I read an article in the New York Times, I think it was last year, talking about or saying that the people who have HIV in Ireland, the older people who have HIV in America now, are the first generation to live to their age with HIV. So is that still the case, or like, do we have many people around the world in their 70s and 80s who have HIV, or, you know what I mean, or is, because I read an article only a couple of days ago that said that the average life expectancy was something like 64 or 65 years, but that's probably including Africa and other countries. So like, are we still in the first generation of people who are kind of on the drugs and who are living, or what's it? You know what I mean?
Yeah, no, actually, that's a really good question, because it's in many ways this is the first generation of people who are HIV positive who are living into their 50s, 60s, and 70s, depending on what age they contracted HIV. And there's research happening already in terms of, okay, well, what is the impact that actually being HIV positive is having on those individuals in terms of the aging process. So we're actually involved here as individuals there's a piece of research that's going on called POPPY. And basically what it's doing is taking a group of people who are HIV positive and a group of people who are HIV negative, and doing just monitoring, and over 50, and sort of monitoring the impact of aging is having on them and seeing whether there's any differences. So it's the treatment that people are on is certainly lengthening their lifespan. and their expectation would be that they would live as long as anybody else. But there may be some findings coming out that saying actually the aging process, they might be experiencing stuff like osteoporosis, etc., earlier in life than maybe others would.
What is that?
Osteoporosis would be to do with your bones, so like a weakening of your bones. So which you would tend to think, well, it will happen when people get into their 70s. And we're beginning to say, well, maybe that's happening a bit earlier for people who are HIV positive, who are living with HIV.
So, but if you're diagnosed with HIV in your 20s or 30s and you're on the treatment, antiretroviral drugs, are you kind of physically as healthy in those early generations as anyone else?
There is an argument to actually say, in some regards, people once they've actually sort of established what sort of like the right treatment regime is for themselves, that they, in some regards, might become even healthier than their peers, because they're very focused in on their health and in terms of healthy eating, alcohol use, etc. So from a physical point of view, certainly in those maybe from 20 up until 40s, yes, that would appear to be the case. It's just now we're sort of finding out, well, what happens when people move into their 50s and 60s. There's another interesting piece of research that's been done over in the UK, and it's finding that whatever with physical health, but also sort of like in terms of mental health, certainly being HIV positive and living into sort of like your 50s and 60s, again, is finding people who are maybe finding themselves isolated. So it also impacts on mental health as well.
Yeah, we'll talk about that in a minute. Just last question on the actual the clinical treatment. Like, are you able to drink alcohol if you're on the antiretroviral drugs?
I'm not a GP, but listening to people who are on antiretroviral drugs, I think yes, they do. People do drink alcohol. The advice may well be not to, or certainly to limit down. But so yes, like any medication, I suppose you are kind of advised not to drink alcohol, but yeah, some people do.
Okay, could you tell us about the services you provide here, and like just expand on what we're talking about here? Do people with HIV in Ireland today have any big challenges, or are the services for people with HIV largely about treatment? Like, for example, do you have any social and recreational services here?
Okay. I think, yeah, historically, the way in which the services have evolved, certainly from a state point of view, which we were saying earlier on, very much around about treatment, because it's crucial that people actually access treatment. What organisations like our own has done, like HIV Ireland has done, is that we've worked around that. So we would be working, when somebody is diagnosed as HIV positive, that it's hugely traumatic impact on their lives. So we would certainly provide counselling for individuals, we'll provide support for people. There are barriers out there in terms of stigma and discrimination, so we would work with people who would feel, and sometimes rightly, that they have been discriminated against because of their HIV status. So we will work with them around that, even to the point of taking cases to the Equality Authority. The other areas that we have become more involved in, and I suppose this is from the point of view of working with people who are living with HIV or at risk, is around community testing. And because again, most of the testing takes place in clinical settings, which is fine for a lot of people, but it's not fine for everybody. And there are some individuals who would find it very difficult to walk up to their local hospital or the local clinic. So we provide community testing here, and that's been really successful. We've been doing that now for 3 years. And we do it, we would plan to sort of like move it out into other areas here. And then I suppose the other area is very much around about education and training and getting out prevention messages, so to ensure that people don't become HIV positive in the first place. So very much around safer sex, around looking after their own sexual health, getting into testing, using condoms, and just being more aware of how HIV is transmitted and how they can actually protect themselves.
Yeah, just talking about going back a few minutes, talking about the prognosis now for people with HIV. The only person that I know of, I'm conscious that has HIV. I probably know other people who have HIV, but I just don't know they have HIV. But is his name Rory O'Neill?
That's right, yeah, Rory O'Neill. Yes.
Yeah, Rory O'Neill.
Pantabliss.
Yeah, that's his character, Paddy Bliss.
Yes.
But he looks like a picture of health, doesn't he?
Yes, yeah.
It's quite remarkable.
Yeah, and I mean, many people do. I mean, we would work with a lot of people here who are HIV positive, who are living with HIV, and there's no like sign on person's head or anything along those lines. I mean, they look very healthy. They do. Individuals, depending on their own lifestyles anyway, will tend maybe at times not to feel so well, and that could be an impact on medication, or it just could be the impact of another type of illness on them that sort of is kind of contraindicated with their medication, so there can be a problem there. But he's very healthy.
Yeah. And he's very active in the marriage of a friend recently. Like
he is, and I think it would be great from our point of view if there were other individuals out there, so like public figures who are HIV positive, who would actually come out and support us as well, you know. But again, that's very much, it's a personal choice for people.
I just have two other questions now. I'll ask you at the end to give a summary of your work and your message here in HIV Ireland. But just before we talk about that, if we can talk about the global picture first, please. I don't know how much of an expert you are on the global picture, but I was reading personally some statistics, and there was great news announced by the UN AIDS there a week or two ago in Addis Ababa in Ethiopia, saying that there are 15 million people on who have HIV on antiretroviral drugs, and it's 6 months ahead of target as regards to Millennium Development Goals. But there are 3.9 million people who have HIV or AIDS. They are largely in Africa and Asia who know they have HIV and AIDS, but they aren't on treatment yet. And there are something like another 14 million people. There are something like 39 million people altogether, and 14 or something like million people don't actually know they have HIV. It's probably good to have a message of global solidarity. Like people who have HIV in Ireland can like relate to people who have HIV in poor countries, and like what do you think? Do you know much about the global picture? Like,
we're not that involved on a global aspect. We're not involved at all on a global aspect. I mean, we know certain things. I mean, you just informed me of some information that I wouldn't have had. I suppose people who are living with HIV in Ireland, I suppose their primary focus initially is on the impact it's had on their own lives, and then I suppose from our point of view, it's the impact HIV is having in Ireland. But certainly, I think if you compare HIV treatment and the situation in relation to HIV in Ireland compared to, say, sub-Saharan Africa, there is no comparison. You know, like it's so much worse in other areas. And yes, I think people like us, organisations like ourselves have a responsibility to raise that as an issue as well. I mean, here, if you're diagnosed with HIV, you very quickly can access treatment. Medication is free in Ireland. So then, as long as you're compliant, etc., things can be not quite positive for you in relative to some people, as you said, can't even access medication. So there are massive global issues in relation to inequality that organisations far better than ourselves are involved in. I certainly Concern would be a major organisation that would be involved on that level.
Yeah, one of the best people ever to advocate for AIDS treatment was the last president of the US, George Bush, wasn't he? He was president of America. I think it's PEPFAR. I forget what the name of it is, but some American program for treating people who have HIV, expanding antiretroviral drugs. He invested billions in that, like whatever he did in Iraq or whatever. But he invested, when he was president, billions in like getting people around the world on, like in developing countries, on antiretroviral drugs. You ever hear about that?
I've heard of it, yes. Again, wouldn't know too much about it, but yes, I mean, I think people, no matter what you think of George Bush and his sort of foreign policy positions, the work that he did in that area, yes, would certainly seem to be extremely beneficial to people.
Okay, this last question now. Finally, Niall, if you were to give a summary of your work and your message here in HIV Ireland to people who have HIV or are afraid they might have HIV, and to the rest of our listeners, what would you say?
Well, I think there's probably two messages. I mean, for anybody who has a fear that they may have contracted HIV, the message is very clear. You should go and get tested, and you can actually get tested free of charge. If you go onto our website, which is www.hivireland.ie, there is a locator map on the website, and basically, depending on where you live in the country, you can find out where your closest free clinic is, and you can get yourself tested. Because the sooner, if you either you are HIV positive or you're not, and if you've contracted HIV, the sooner you get onto treatment, the better it is for you as an individual. And again, and I suppose, from a point of view of somebody who's living with HIV, again, the message will be very clear in terms of treatment, and making sure that you've got the right treatment regime with whatever clinic that you're involved in. And then if there are other aspects of your life that HIV is impacting on, people can need counselling around it. It can impact on employment, it can impact on their personal life and family life. Again, you can talk to us. There's another organisation called Positive Now, which is an organisation set up purely by people living with HIV, and again, their website is positivenow.ie, and they're extremely good in terms of actually supporting people who have been newly diagnosed or who are living with HIV.
I just thought something there before you give your other message out, but like if you're going for a test for HIV, do you or any other service providers actually talk to the person before they do their test? Because like if you don't have any information and you just give them a test and you have HIV, you're going to be shocked.
Yes.
Do you do any kind of talking to the person beforehand?
Yeah, absolutely. If somebody requests that, no problem. We have testing here the second and fourth Wednesday of every month, and we always have a counsellor on site. So somebody can talk before they take the test. We also have the opportunity, if somebody is thinking about it, they can ring in and say, listen, I'd really like to come in. They can either talk to us over the phone, and we would have some information on our website, or they can come in and talk to us. Yeah, I mean, and you're absolutely right. It's crucial, that you don't, you do really need to think through a wee bit the impact that it may have on your life. And then if unfortunately you have contracted HIV, then definitely there's conversations that you need to have.
Okay, no, thanks very much.
You're very welcome, Darren. Thank you.